phone call from Oklahoma. David, good morning. How are you?
Hi, I'm fine. Yeah, I got a quick question. A couple of years ago, I slipped on my deck and hit the back of my neck, and I guess I hurt my 6th or 7th vertebrae or whatever. Well, it didn't bother me for a long time, but then all of a sudden I started getting a lot of pain in my arms and my hands, and so I had an MRI. They went through, and so I've been starting to get these cortisone shots in my neck. But the problem is, and what I'm thinking is that they kind of told me that there's nothing that they can do on that because they're saying that the discs are bulging, and that's what's cutting the nerves off to my arms and my hands. But am I doomed to taking pain pills and getting these shots every, so often?
I have a question for you. How long before the neck injury and the onset of symptoms?
Oh, it was a couple of years. I slipped and hit pretty hard on my deck. I slipped on some ice and hit just the corner edge of my deck on the back of my neck, and it was 2 or 3 years. So this
could be post-traumatic. It could be something that happened after the fall, or it could be just a coincidence. I mean, couldn't it?
Yeah, I guess, yeah. All right. But I mean, that's the only thing that I can think of that would have hurt my neck.
Scott, you're the expert.
Who told you that there's nothing else that can be done?
I want to say one of the other doctors. I can't.
One of the doctors who does the injections?
Yeah, I want to say. Okay. But I'm not. Just like I said, I'm not sure. It's been going on a while. So, but I'm doomed because they told me the last time I got a shot, they said that's the last one I can have for 3 months. Well, the shot's the only thing that stops it to where my arms and hands don't hurt so much. But now, I mean, I'm past. I had that shot maybe 3 weeks ago, and my arms and hands are hurting so bad and they told me that I couldn't get another shot for 3 months. So I don't know what to do.
Okay. Number one, a guy who does injections, and I love spinal injections. I refer patients for them all the time. We have guys at Texas Back that do them. It's a great non-surgical treatment, but they don't always work. And if you've got nerve symptoms like you were describing and you've got disc issues that are pinching nerves, there's always the possibility that surgery can help. I can't tell you for sure, it's radio, but get a consult from someone who does surgery, not, and I don't mean to sound cynical here, not someone who just does injections, because the motivation for someone who does injections is to have you keep coming back for injections, not to go to a surgeon and potentially get cured and not require injections anymore. So I don't understand not recommending you a surgical consult. And many times I'll say no, injections are the only treatment, in which case you'll be reassured that that's the case. But get an opinion.
Well, see, now the nurse that actually even gave me the MRI, she was telling me that the one bad thing about getting surgery on my neck, she was saying that the longer you wait, the better, because they said that a lot of times you can have a domino effect. You can fix that 6th and 7th vertebrae, but then the vertebrae below that can start messing up.
Well, David, we're coming up against the top of the hour, so I want to leave you with this. No, I don't think you're doomed. And what Scott was saying is absolutely correct. There are options, and it may not necessarily be something surgical. It may be traction. It may be physical therapy. There may be other options, and I think you should explore those options before you have to depend on pain pills for the rest of your life.
Right. I appreciate it, Doc.
Thanks, bud. Keep listening.
Yeah, thanks for taking my call.
All right, Inside Sports Medicine, 855-787-1033 coming up.